Well, typically we think of skin care in the summer, but that's a dangerous understanding. Skin cancer is the most common type of cancer in the United States, claiming half of all cancers diagnosed. For this week's Take Action Thursday, board-certified dermatologist Dr. Mary Farley with Anne Arundel Dermatology is joining us this morning. Thank you so much for coming in, Doctor.
Thank you for inviting me. I'm happy to come and talk about this very important topic because, like you said, it really is half the cancers that are diagnosed. And the statistic now is 1 in 5 Americans will develop a skin cancer sometime in their lifetime. So it's very real, and it's something that people need to be aware of.
And it's something that you think about skin cancer, you hear about it, but you always associate that with summertime because we're putting on sunblock. Correct. Or, we're covered up this time of year.
Correct.
Screenings are still very important in the wintertime.
They absolutely are. Anyone who has skin is at risk of getting a skin cancer, and we typically think of it in the summertime, but really people need to be aware and check their skin on a regular basis. We encourage people to do that on a monthly basis. There's 3 main types of skin cancers. There's basal cells, squamous cells, and melanoma. And so basal cells often present on sun-exposed skin, such as the face or the arms, often as a pearly or shiny mole that doesn't go away. It can also be an area that doesn't want to heal, or a persistent red spot that stays for a couple of months. So sometimes, because they're slow-growing cancers, people ignore them, and they can give you a false sense of security as almost healing and then reforming. But an area that bleeds easily on your face when you wash or dry it, or a little area that keeps scabbing up in the same exact location, really should draw your attention. Okay. Squamous cell cancers often are more of a hard, dry bump, and people think of them as maybe being a persistent wart or a red spot that's scaly, looks like a little eczema, but again, it doesn't go away like another area. That should also prompt people to seek care. And then the most deadly type of skin cancer is a melanoma, and although it only consists of 3% of the skin cancers, it causes 75% of skin cancer death. So that's a mole that's changing, or a dark spot that also is different. It's really the mole that looks different than your others. And if people think of it as almost the ABCDs of melanoma. So
that's what I was getting to. Very good. You got it.
So something that's asymmetrical, has an irregular border, color that's different or has more than one color within it. D is diameter, bigger than the size of a pencil eraser, and then E is evolving, something that's changing. So a change in size or color or appearance of even a stable mole that you've had for many years should draw your attention. Okay. Caught early, they're very curable. If left alone, they can be deadly. So it really is important that you look at your own skin, but also seek the help of experts if you see something that's causing you concern.
And come to somebody just like you, a physician just like you, to help answer those questions.
Correct.
We appreciate that. Okay, well, you're going to stay with us because we have some callers and we also have some Facebook posts we're going to answer right after the break.
Wonderful.
Of course, right after the break, dermatologist Mary Farley will be back to take your calls about skin cancer. Now, if you have a question, our phone lines are open right now, 410-481-4545. You can also send us a tweet at Fox Baltimore or go through our Facebook page. 7:52 is the time. You're watching Fox 45 Morning News, all local, all morning. And we are back. Dermatologist Mary Farley with Anne Arundel Dermatology is taking your calls about signs of skin cancer for our Take Action Thursday. Now, if you have a question, our phone lines are open right now, 410-481-4545. We want to hear from you. You could also send us a tweet at Fox Baltimore or go through our Facebook page. And, Doctor, I want to go first right to the phone lines. We have one caller right now that's asking an important question about multiple tumors that she's been dealing with. Good morning.
Good morning. How are you?
I'm doing all right. I'm sorry I missed your name there. Can you tell us your name and then have your question for the doctor?
Sure. It's Kathy.
Kathy?
I've had multiple skin cancer on different parts of my body. It's not just on my face. It's been on the inner part of my calf where there was a tumor removed. And then I just had one cauterized last Tuesday, this past Tuesday. But I've had them on my face where they've had to actually cut them out. I mean, do they keep coming back? Will it ever go away? Or is this something I did because of the skin damage?
Unfortunately, people who have one skin cancer are at risk of developing another new one because the sun that was shining on parts of your face was also shining on your scalp or your arms or your legs. Although you can't undo past sun exposure, you can certainly keep from getting new sun exposure by using sunscreen and also by seeing a dermatologist on a regular basis. It's not too late to start, but it really is important to get screened regularly, especially if you have a history of skin cancer. Not only keep an eye on your own skin, but use the help of a professional to help you detect things early and also in areas that you can't see. They're trained, that's what they do on a regular basis, and they can be with you as a team to help you keep the best care of your skin.
But obviously she should then speed up. A regular annual screening should actually be more for her because she's had the history.
Right, because of her history, she should be seen more regularly. People who have a long-standing history of sun exposure, either through occupation or recreational activity, fears such as yourself, should probably be screened by a dermatologist maybe once a year, certainly sooner if you notice anything. But people who have a history of skin cancer should be seen on a more frequent basis. Your dermatologist can help you. Some people actually get seen every 3 months, every 6 months, but they'll guide you.
And how about children, though? How young? I mean, if you start seeing something, how quickly should we get that?
Well, if there's a family history of skin cancer, certainly they're at higher risk. Melanoma does run in families. Skin cancer is more unusual in children, but it can occur. And so anything that's new or changing, even in someone young, is important. And in addition, people who are fair-skinned are at risk, and you can certainly help your kids by using sun protection early. It's never too early to start. And another myth is anyone can get skin cancer, not only the fair people, but even people with darker complexions. If you have skin, you're at risk of getting a skin cancer.
And the best part about this is that you guys will have a booth. Anne Arundel Dermatology will have a booth February 28th at the Be More Healthy Expo.
Absolutely.
And you'll be able to actually help people and do some screenings there, too, and answer questions.
Absolutely. We will participate. We're happy to see patients. We encourage people to get out. May is going to be has Melanoma Monday, Skin Cancer Awareness. It really isn't too early to start, even though it's hard to imagine the sun at this,
At this point, like
point.
today, yes.
Absolutely.
Doctor, thank you so much. Dr. Mary Farley from Anne Arundel Dermatology. Now, of course, if you'd like to get some more information, make sure that you do mark your calendar. It's coming up, quickly approaching. Be More Healthy Expo at the Baltimore Convention Center is taking place Saturday, February 28th. Starts at 10 in the morning, goes till 5. Screenings all day long. And, of course, it's free. Coming up, it's our very own Traffic Jam Jimmy. Is he up for the challenge? We'll see if he has what it takes to fill the potholes that we find all over our city. You definitely don't want to miss this.